Hi, my name is Tanya. I'm going to be your nurse today.
Hi, Tanya. My name's Julie. This is my daughter, Lily.
Nice to meet you.
Nice to meet you. I was up this morning early with her because she was crying, and I was changing her diaper, and she seemed a little grumpy, like she had some gas or something. So I was kind of doing that thing with the legs where you just kind of move them around to try to get some gas out. And she just started freaking out. Like, I touched her leg, and she was just totally freaking out. So I don't know what is going on. And I tried to feed her, and I tried to, just swaddle her, and she just is inconsolable.
Yeah. Did she eat at all, or?
No, she wouldn't eat.
She's not eating. Yeah. Is she producing wet diapers?
Yes. Yep.
Okay.
Yeah.
Well, that's good. Does she have a fever or anything?
No, she's been fine. I don't know. It was really came on fast. I don't know what's going on.
And you tried to give her a pacifier. Does she use a pacifier?
No, she doesn't use a pacifier.
Yeah. Okay. Well, I'm going to take a listen to her lungs and just check things out. Really
Okay.
quickly. Do you want to maybe lay her down on the bed?
Sure.
Okay.
Oh,
honey. Is anyone at home sick?
No.
No. Okay.
It's just her and I.
Okay.
'Cause
Her leg seems to be bothering her.
Yeah.
Yeah. Okay. Has she fallen or anything?
No.
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 Okay. All right. Well, I'm gonna go talk to the doctor, and she'll be in to see you shortly.
Okay.
Okay. Do you need anything before I go?
Nope. I think if we can just hurry.
Yeah.
Something's wrong.
Sure.
Okay.
Okay.
A 5-month-old female admitted to the emergency room for inconsolable crying over the last day. Possible pain on right leg. Full-term vaginal delivery, no complications during labor. Infant has been breastfeeding up until incident. Baby responds to painful stimuli upon palpation. No obvious deformities in right leg. Vitals are as followed. Respiratory rate, 50. Pulse, strong, regular, 140. Blood pressure, 70 systolic. Skin, warm, pink, and slightly diaphoretic. Eyes, pearl, with noticeable tint of blue in the sclera. Good muscular tone. Temperature, 36.6.
Hey, Tanya.
Hi.
So I just reviewed your notes on our patient N16, and I completely agree with your assessment on the right leg. I'm going to put in an order for an x-ray if you could get transport done on that.
Okay. Great. Did you see my note about the sclera of the baby's eyes? It was really blue.
Yes, I did read that. That was a great assessment. Thank you. I'll follow up on that.
Okay. I'm going to tell the family about the x-ray.
Okay, sounds good. Thank you.
Thanks.
How are you?
Hi. We're doing okay.
All right. Well, we got the results to your x-rays.
Okay.
I'm going to pull them up here on the screen for you.
Okay.
I got some bad news. It does look like baby has gotten a fracture on the right tibia.
What?
And so if you take a look here, I mean, it's kind of hard to see, but right over here on the right tibia, got a little one. The other problem is that it looks...
How did that happen?
Well, I'll get there in a second. If you see here that there's some other wounds that look like they've taken place, so it looks like she's got some different fractures that they're at like different stages of healing right now. So she sustained some other injuries as well.
Oh my gosh.
So I'm not sure what's going on. So if you could give me a little bit of information, what took place?
Sure. What do you want to know?
What were you doing right before, what made you bring her in?
Well, we were both sleeping, and she got a little fussy, so we got up. It was like 4 a.m. maybe, and she seemed like she was having some gas pains, so I was changing her diaper, and I was doing the little leg bicycle thing that they teach you at the pediatrician to get the gas out. And when I was doing that, all of a sudden she just started screaming like crazy. And I thought maybe it was gas, but then it was like she just wouldn't stop crying.
Okay. Was she real fussy? Had she been crying for a long time?
Before that?
Yeah.
No.
Okay.
No.
And you said you were sleeping prior?
Yeah.
Okay. Did you have a long night before?
I mean, I was up kind of late last night, but...
Were you working?
No, I stayed home with her.
Oh, okay.
Yeah.
Have you been stressed out or agitated at all?
I mean, I'm tired because of, having a baby, but
Okay.
nothing out of the normal.
Do you have any support at help? Do you have anybody that can come and help you at all?
I mean, my mom kind of comes sometimes, but
Okay.
when she feels like it.
All right. Well, do you think there was any possibility that you were just a little rough with her?
No.
Maybe she woke you up and you're kind of tired and didn't really notice it.
I wasn't rough. I was being gentle.
Okay.
Why are you asking me that?
Well, I'm just trying to figure out exactly what it is. It's not really common to have a break like this for the type of injury that you're explaining to me. So I'm just trying to figure it out.
Okay.
Another possibility is that it could just be a spontaneous break, and that is common with babies that have weaker bone density. And so, in this picture as well, you can see that, you have some thinning here in the bones and over on this side. And so, with that, I'd like to do a couple extra tests and try to figure out what's going on, and we can work things out.
This is just weird. I don't understand why this is happening.
Okay. So the couple tests that we can do is there's a simple blood test. We'll just do a blood draw.
Okay.
And then there's another one, which is a biochemical test, which is a skin biopsy.
Oh, wow.
And,
it seems really serious.
It's really not. I mean, it sounds like it. What we'll do is we'll put a little anesthetic on the finger.
Okay.
And it's a little punch biopsy, so we'll just take a little.
Oh my gosh.
Little
is that
biopsy.
Gonna hurt her?
It won't be bad with that anesthetic. It'll be no problem.
I just feel so bad.
And so we'll send that off to lab, and that can help us rule some stuff out and figure out what's going on.
Okay.
In the meantime, I'm going to send my PA in. That fracture's not very big. It's pretty minor. So what we can do is we can splint that, and just as long as it stays immobilized, it should be no problem healing.
Okay.
And so we're going to do that and just be real gentle with her, and I'll give you a call back when we get those results.
Okay. Do you think that we can give her something for the pain, maybe?
Yeah, I'll definitely prescribe something. We can give her a little bit of, like, baby Tylenol or something. We'll help out for sure.
Thank you.
Do you have any other questions for me? I know it's a lot of information coming at you, and I don't really have answers for you at the moment, but...
No, I just feel like everybody thinks that I did something to her, and I didn't, so...
Okay.
I'm just upset, and I'm worried.
Well, we'll get to the bottom of it. We'll figure it out, and we'll get her healed up and off to being a nice, happy little baby.
Okay.
Okay?
Mm-hmm.
All right. Well, thank you, Julie.
Mm-hmm.
Have a good day.
Thank you.
Hi, Julie. How are you? I'm Dr. Woodruff.
Hi. Nice to meet you.
Nice to meet you.
Yeah.
How are you doing?
We're doing okay. We're doing
Good.
all right. Her leg is starting to feel better, but it's still a little sore, so
Okay.
trying to be really careful.
Yeah, I know. It's stressful, I bet. How are you?
I'm okay. I mean, I've, been through the ringer with the whole child abuse allegations, and, I've definitely have never hurt her, so it's been really emotional, and I don't know why she broke her leg, and I'm just feeling really stressed out about it.
Yeah, I can imagine. It's a lot to take in a really short period of time.
Yeah.
So I have reviewed the tests that Dr. Londa ordered in the emergency department, and I just have these results here that I'd like to go over with you. So after careful review of these tests, Lily does have a condition called osteogenesis imperfecta.
Oh, wow.
I know, it's kind of a scary word. It's also known as brittle bone disease. Is that something you've ever heard of?
Yeah, I mean, I went on the internet and kind of just pulled up some things, and I came across that, but I didn't really understand what was happening with it. But I did read something on WebMD about it.
Right.
So.
Yep. The internet can be kind of a scary place.
Yeah.
So we don't always encourage our patients to go on there to find medical advice, but
Keep running. Are you playing right now?
Mm-hmm.
okay. So osteogenesis imperfecta is a genetic disorder characterized by bones that break easily.
Mm-hmm.
I know it sounds kind of scary, and actually with this particular condition, there's 8 different types.
Mm-hmm.
Lily has been diagnosed with type 1, actually, which is a good thing because type 1 is the least severe or the most mild. So,
oh, good.
Yeah.
That's a load off.
We'll talk about some things that you can expect as Lily gets a little bit older.
Mm-hmm.
But one of the things that I wanted to talk to you about is that osteogenesis imperfecta is inherited. It's a dominant gene disorder. So is there anybody in your family or anybody on Lily's father's side of the family that has this disorder?
Not on my side of the family, but now that you say that, her dad did break a lot of bones quite often.
Okay.
So.
And never mentioned that he had any type of...
No, I don't know if he ever got diagnosed, but, and yeah, I mean, I wasn't with him for that long, so I don't really know his history very well.
Okay, well, I understand. So, like I had mentioned earlier, Lily does have type 1.
Mm-hmm.
And what's so different about type 1, it's actually the most common, but what's so different about it is Lily actually makes collagen, which many of the other types, the patient does not make collagen, but Lily, in fact, does make collagen, so that's a really good thing.
Oh, good.
The bad thing is that she only makes about 50% of what a healthy, normal person makes in order to keep their bones healthy and strong.
Okay.
And so that's why she has a difficult time, and she's at more risk for dislocating joints or breaking bones.
Okay.
Yeah.
I don't really know what collagen is.
Sure. So your body has a lot of different types of collagen, and the one that's affiliated with this particular disorder is type 1 collagen. That's the most important one. It's a protein, and it makes our bones really, really strong.
Oh, okay.
And so with osteogenesis imperfecta, it typically involves this type 1 collagen. And again, in Lily's case, she's only making about 50% of what she needs to be making in order to keep those bones healthy.
Okay.
So...
how did she get this? I don't really understand. Like, I mean, I know genetics kind of means something, but...
Well, genetics basically just means that she's inherited this from a gene that either you carry or that her father carries.
Okay.
It's not like a virus or a bacteria, anything like that. It's nothing that she caught. It's nothing that she's,
So nobody can get it from her.
No, she won't go to school and give other kids osteogenesis imperfecta.
Okay.
But most people that have this disorder, it's inherited.
Okay.
There are some types of gene disorders where it's called spontaneous mutation, but that wasn't the case so much for Lily.
Okay.
So these are all really, really great questions. Are there any other questions that you might have?
I mean, I can only imagine, like, her as a 2-year-old, like, how is this going to affect her when she's moving and getting older?
It's definitely a lot to take in, and I can understand that you're overwhelmed. Some of the things that I want to talk to you about are things that you can expect in the future with Lily. So we've already experienced some bone fractures, and this is going to be common, and it's scary.
Yeah, because I was being really gentle with her.
I know you were. And it's little things that we normally would do with our babies that you don't realize you're putting them at risk for a fracture or possibly a dislocation. So those are some things that we're going to educate you on later and just teach you how to hold the baby and do a few other things differently.
Okay.
Some of the things that you can expect is she's going to bruise easily. So you might see a large bruise on her, and you might not understand or remember where that might have come from,
Okay.
or there wasn't really a fall that was affiliated with that.
Mm-hmm.
So that's something that you should be watchful for.
Mm-hmm.
You also might notice that she won't be as tall as some of the other kids in her class, or as tall as some other family members. And these are also just predictions. We never really know where she's going to be at, but
Okay.
a lot of children with osteogenesis imperfecta have a tendency to be a little bit shorter, but not everybody.
Okay.
Some of the other things that you might expect with her as she gets older are spinal curvatures, like scoliosis.
That's terrible.
Well, and it's just basically could be a slight curve in the spine. That also will have a little bit to do with her being slightly shorter.
Okay.
So some other features that you might notice is a triangular shaped face. And she might actually have some bone deformities, especially if she gets a fracture. And as that bone heals, you might notice there's a certain deformity from it maybe not healing the way we'd like to see it heal. Some other things that we can consider are brittle teeth. She might have some teeth that are brown, and typically when one tooth comes in brown, you'll notice that all of the teeth will come in brown, and we'll just sort of see where Lily's at when her teeth come in.
Did I do something wrong? Is there something I can do?
No, there's really not much that you can do, but a couple other things that we can go over. She might also have some hearing loss. So be watchful for while she's in school. If she's, maybe not understanding any information, she might not actually be hearing it. So just a couple things for you to be, watchful for in the future. And then last, I think you've already noticed this. Have you noticed that Lily has some blue in the whites or the sclera of her eye?
I did notice that. I didn't know what it was from, though.
Yep, and actually, children with osteogenesis imperfecta, that is one of the symptoms that we'll see is a little bit of a blue tint in the sclera of the eye. Actually, what I find to be so interesting about this is that the Clinton Community College nurse was the one that made that assessment.
Wow.
It was very astute of her, and I actually feel that this condition is overlooked by a lot of doctors,
Right.
and I thought that was a great assessment finding on her behalf.
Okay.
Yeah, that Clinton Community College really puts out some wonderful nurses.
Nice. Awesome. I mean, is there like a cure for this, or can we have surgery to fix this?
Unfortunately, there is no cure. I know. Again, it is a lot to take in, but what we're going to go over today and what all of your future appointments are going to be about is education. And we're going to really aim our treatment at increasing overall bone strength for her.
Okay.
And we want to give her the most normal life as possible. So if we can increase the bone
I
strength.
mean, it's not going to make her like die really young, is it?
No.
Because something I read on the internet said that.
We're going to really hope for the best with Lily.
Okay.
With her condition, even in type 1 being the most mild and the least severe, the severity really ranges within that type 1. And so we're not really sure what we're going to get until Lily gets a little bit older.
Okay.
Most people, though, especially when we diagnose them at an early age, live very long and healthy lives.
Okay.
So the other thing that I feel like this particular condition is misdiagnosed often, or they don't diagnose it, is because it's very uncommon. 1 out of every 10,000 births are children with osteogenesis imperfecta. And so it kind of gets overlooked quite a bit.
Okay.
So, but those were all really great questions. Is there any other questions that you have for me?
I think I just really need to learn about what I'm supposed to do and how I'm supposed to do it. So, yeah.
Well, I think as we move forward, a lot of what we're going to be focusing on is education.
Yeah.
And again, I know this is a lot to take in, and we're here for you and make sure that we give you the support and education that you need as you move forward.
Yeah, because I don't know how I'm going to do this by myself. So I'm really nervous about it. Thank you.
You're welcome. Thanks for coming in today.
Hi, so I'm back to do some teaching for you as a new parent diagnosed with osteogenesis imperfecta. And mainly, like Dr. Woodruff talked about, what we want to do is prevent Lily from getting more fractures.
Mm-hmm.
So the main thing with that is we have to make sure that when you transfer her and hold her and like change her diaper, we're very careful.
Okay.
So just like every time you want to move her or pick her up, you want to make sure that you support her head and her back with that one arm. Yep, you're doing great. And you want to web or spread out your fingers like this.
Mm-hmm.
And then with the other arm, you're doing great. Support the butt and the legs.
Okay.
Yep. So practice placing her on the table. Yep. Perfect. And you never want to straighten out any arms or legs or anything to prevent any fractures.
Okay.
Another very important thing is you don't want to pick her up underneath her armpits because that could damage her.
So I'm going to spread
ribs.
my fingers
There
and
you go.
hold with fanned fingers.
Yep.
Okay.
Perfect. Perfect. And also, when changing her diaper, you don't want to pick her up by her ankles. You want to gently put your hand underneath her butt and then remove the soiled diaper and then put another one underneath. And we can practice that
Okay.
a little bit later. I just wanted to explain some things to you.
Okay.
So that's as far as handling her. And also, I printed out some guide to Osteogenesis Imperfecta for the new parent.
Okay.
And in here, there's some great forms about different kinds of car seats and strollers that Lily might need.
That's always hard to get her in the car seat.
Yep. And so these different car seats, you can actually use them as a baby carrier, so you don't have to take her in and out every time.
Oh, okay.
Yep. You go out of the car, and there's some pictures of them in here. I can show you.
Okay.
And just some more information for you to look over at home when you're kind of settled in and ready to learn. And I just wanted to let you know you're doing a great job with breastfeeding Lily. It's the best nutrition for her.
Awesome.
And as long as she's latching, some kids with osteogenesis imperfecta have problem latching, but since she's latching, that's the best nutrition for her right now. So you're doing a great job. Just keep up with that.
Okay.
Oh, Tanya and Julie, I'm glad I caught you, actually. I've been working on this certificate. Actually, it's more of a documentation in the event that you happen to get back into the emergency room. And this is just to kind of explain to the healthcare providers a little bit about your medical history. This way you don't have to kind of go through some of the same events that you did for this particular experience. I know that was a little bit tough on you.
It's traumatic.
I understand. And again, we do have protocols that we do need to follow in the hospital and making sure that all of the patients, especially children, are safe and being cared for appropriately.
Yeah, I understand.
But this one specifically documents a little bit about Lily's history with type 1 OI, and just carry this with you at all times. You never know if you're going to be out of town or out of state and be using a hospital that isn't familiar with Lily and isn't familiar with her medical history. So do you have any other questions for me? Well,
I mean, does she need to be on any medication or anything?
Not at this point. As we learn a little bit more about Lily's condition and how severe her signs and symptoms are in the type 1, we'll kind of move on from there. There are some medications out there. There's one called bisphosphonate. It is administered IV, and that particular drug is specifically made for patients with OI.
Okay.
And it's given intravenously again, and it sort of helps. Easy way to explain it is sort of helps with stopping the bones from naturally breaking down. It's a process that our body goes through normally through these breakdown system, osteoclasts sort of break down the bone, and what this medication does is sort of inhibit that process.
Okay. But we don't need to take it right now.
It's not anything that we're going to look into right now with her type 1. Again, it's just something that we're going to watch her and just sort of see how severe her type 1 is and if that medication is really in need.
Okay.
So, again, really great questions. Anything else for me?
I think I'm good.
All right. Well,
Thank
it was really
you.
nice meeting you.
Thanks
Good luck
for your
with
help.
everything.
Thank you so much.
Yep.
evaluation on 16, and I agree with your assessment about the left leg or the right leg. And I wanted to send. I'm going to. Fuck me.
Okay, let's.
I tried to put my head down. I'm sorry.
No. What would you do next? I'd be really careful with it.
Can you guys start over? My shadow got in on the back. Sorry.
I was like, what are you giggling about? It's a genetic condition. It's an inherited. I was doing so good.
But if
Oh.
you get tripped up, don't.
Okay.